Hi, I'm Donald. Today we're at the Cameron Hospital in Angola to talk to some Angola high school students in the HOE program. Come on.
Hi, my name is Donald. What are your guys' names?
I'm Leah. I'm Avery.
All right, and what program are you guys in?
We are in Health Occupations Education, and today we are in Med-Surg.
All right, what inspired you to get into this program?
So in the last year, I have had 3 surgeries on my knee, and the nurses have been like my biggest help, and they've been really comforting. And I've always wanted to be in the healthcare field, but it just kind of solidified what I wanted to do.
I've had a lot of family members in the hospital, and I've just seen healthcare workers around and wanted to be like them.
Is there any specific field that you guys are looking at going into?
Right now, I'm looking at OB and labor and delivery. I think that's really cool.
I'm looking into surgery.
Okay. What's something kind of unexpected that you guys ran into coming in?
For me, probably just the workload that the nurses actually have and all the things that they do.
For me, it was just the smaller departments and what they did, and the lab and the techs.
What does a typical day look like for you coming here?
So since we're just students, we will come in for the first 3 periods of our school day into the hospital, and we will be here from about 8 to 10:30 depending on where we're at. And typically we just observe.
So what's some advice that you would give to somebody else who's looking to join in?
I know for me personally, this program has definitely been a blessing as far as I wanted to maybe go into imaging if nursing didn't work out, and after my clinical I realized it's not for me. So it just kind of gives you some true perspective on what it's actually like and can show you what you like and what you don't like.
I would say be assertive. Whatever you want to do, if you want to follow someone, make sure you go and do that and see as much and learn as much as you can.
Is there one word that you guys have that could describe this whole experience?
I would definitely say eye-opening.
I would just say it's fun. You get to meet a lot of people and a lot of healthcare workers and see what they do.
And then through it, have you guys learned a skill that you want to show me?
Yeah, today I can show you how to get a patient out of bed that is on fall risk.
All right, what's the use for this?
So a lot of patients, especially on Med-Surg, they tend to be older, or they had just gotten out of surgery, so they had an inpatient surgery, and they also can be at risk because of the medications they may be on, or just any condition or sickness that they might have. So it's used quite often on Med-Surg. We'll show you. So first things first, with the fall risk patient, you always want to make sure that they have their call light accessible. This just makes it a lot easier for them to get what they need. It's just a push of a button rather than trying to get up and do it themselves. And then when you have a patient at risk, you're gonna have this belt and you're gonna have them sit up. With this belt, you wanna make sure that it's not too tight and not too loose, so the patient is secure and feels secure, but the belt is also not super loose. And then a lot of them, if they need help, you can help them with their legs and getting them to the floor. And then once they're good and comfortable and ready, 1, 2, 3, good. All right, use the walker. We just want to make sure the walker stays secure. And then take your time, and you just go one step at a time.
Thank you for learning more about healthcare careers with me today. To learn more, talk to your counselor or the link below. And always remember, healthcare begins with you.